Hello, I'm Dr. Lynn Schuchter. I'm a medical oncologist at the University of Pennsylvania, and I'm representing ASCO, serving as ASCO past president. The question today is, how is ASCO ensuring equity in across Egypt and Africa to ensure improved patient outcome? And I would say that ASCO is addressing this on several fronts. One important area is access to clinical trials and ensuring that all patients have access to clinical trials. And we have a recent policy statement and a white paper that really describes how to ensure enrollment of patients from diverse backgrounds onto clinical trials. This is really essential as we test the evaluation of new medications, new treatments, that we have patients from around the world, and we represent all patient populations. So this is a priority for ASCO, is to design clinical trials that ensure equal access to all patients on clinical trials. Secondly, development of the workforce. So we want to also ensure that clinical investigators from different perspectives and different backgrounds have the skills and the training to do clinical trials. This is also critically important. And so ASCO has a number of important programs that are training international investigators in Egypt and in Africa, where we're giving them the necessary tools so that they can develop their own clinical trials, develop clinical trials for their own patients in their own country. So giving the skills necessary. And so we also believe that equity in cancer care means access to the very best treatments and the very best evidence. And so this is where ASCO guidelines play an important role. We want to make sure that patients, wherever they are treated, are receiving the best standard of care. And so ASCO guidelines, working with our partners around the world to ensure that we're reflecting resources in the country and what's available. We don't want to be giving substandard treatment. We want to establish quality guidelines so that patients get the best care. So I would say that ASCO, this is an incredibly important priority around access to the latest clinical trials, ensuring enrollment, making sure that there is a diverse workforce and training clinical investigators around the world to have the skills to do the clinical trials, and then through our guidelines, ensuring really the highest quality of cancer care for every patient.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.